my name is Melissa Pulice. I am a clinical and lab instructor for the LPN program at United Career Institute. I am here with Berdar, one of our practical nursing students, and she is going to be showing you how to put on a colostomy bag. We have already gone in, assessed our patient, taken the old one off, and cleaned around the stoma site, and now she is going to prepare to put the new bag on. She is washing her hands and putting on clean gloves. While we are doing this, we always assess drainage and how the stoma looks. And since she has already done that, she is now going to measure. And you want to make sure you're measuring the stoma to leave 1/8 to 1/4 inch around the stoma site for any kind of swelling or expansion of the stoma site. We do not want to cut off blood supply. She is then going to take her measurement and place it on the new bag, and she is going to cut the correct size in to place on the patient. She is going to then stick the bag to the wafer. There are some bags that clip on, there are some bags that stick on, and there are some that are one unit. This is a stick on. And you want to make sure that you stick it on prior to putting it on the patient so that you're not pushing on their abdomen when placing the wafer onto the abdomen. Depending on what the patient needs, you may have to add some other barriers to the skin, but this patient's skin is nice and clean around the site, so she's just going to put some skin prep around there to help the wafer stick to the patient. Now she's going to peel the back of the wafer and then place it onto the patient. And she's going to hold pressure with her hands for a few seconds to make sure that it sticks to the patient. If the patient is emptying it themselves, we hang it down for them to, we hang the bag down towards their legs so that they can empty it over a toilet. If we are emptying it for them, we hang it to the side so that we have easier access to it. And then we provide the patient their privacy, wash our hands, and leave the room. Make sure they're safe.